Hello everyone, I am Dr. Prabjot Singh, MD Anatomy from AIIMS Jodhpur. So in this video, we are going to talk about the basal ganglia. What is it? It is basically the white matter, it is the grey matter that is embedded inside the white matter. Let's have a look. So normally, this is the grey matter on the outside and this is the white matter. But can you appreciate this? This is also the grey matter that is embedded inside the white matter. So this is the basal ganglia. So what are the parts of basal ganglia? Basal ganglia comprise of corpus striatum, claustrum, then you have the amygdala or the amygdaloid body, plus subthalamus and substantia nigra. These are not structurally related to the basal ganglia but functionally related to the basal ganglia. Okay, so now let us have a look on these structures over here. So corpus striatum comprises of caudate plus lentiform. Lentiform further comprises of putamen and globus pallidus. So this is caudate, this is globus pallidus, this is putamen, and this over here is your internal capsule. Then this thin grey matter is your claustrum. This white matter between putamen and claustrum is your external capsule. The white matter lateral to the claustrum is your extreme capsule. So this is the basic orientation. So basically the corpus striatum and putamen are connected with the help of some striations. That's why it is known as corpus striatum. This is about the basic orientation. Now we know that the brain is developed in the form of neocortex, paleocortex, and archicortex. Archi is the oldest, paleo is the middle, and the neo is the latest, recent. All the way, or the way I like to call it, Naya Pila Purana. Okay, so putamen is your Pila, paleo. These two are the part of your neo. Now let us study these structures one by one. Okay, so the first one, that is your caudate. Caudate nucleus is basically large comma shaped nucleus. So it is somewhat like this. Over here you have the lentiform and it rises from the lentiform so it has a head, body, tail. The tail is associated with what we call as amygdala. Over here you have your lateral ventricle. So now I will draw the lateral ventricle and accordingly we will see how is the caudate related with the lateral ventricle. So this is the lateral ventricle. This is the lateral ventricle, this is the third ventricle, and I'll draw it over here. That's the caudate nucleus. So this part is basically the head. This part is basically the body, almost till here, and this lower part is your tail. So the head is forming the anterior part and floor of anterior horn of lateral ventricle. The body is forming the floor of majority of lateral ventricle, and the tail is forming the roof of inferior horn of lateral ventricle, because this is the inferior horn, this is the superior horn, and this is the posterior horn of lateral ventricle. So that is how the caudate nucleus is arranged. Now let us have a look at the next nucleus, that is the lentiform. Lentiform, as the name says, it is lens shaped, biconvex. So you have to draw. This is the internal capsule. Over here I have the lentiform. This is the caudate, and over here I have the thalamus, and over here I have the subthalamus. This is caudate. Lentiform is divided into two, globus pallidus and putamen and globus pallidus. So this is my lentiform. Now let us have a look at the lentiform in detail. So this is putamen, and this whole is globus pallidus. Globus pallidus is further divided into two parts, the medial part and lateral part. So now we need to have a look, we need to label these divisions of the structures. Now this is known as the medial medullary lamina, and this is known as lateral medullary lamina. So the lateral medullary lamina is dividing the lentiform into putamen and globus pallidus, and medial medullary lamina is dividing the lentiform into the lateral and medial parts. Now let us write about these, the putamen and globus pallidus. Putamen is basically your lateral one, and globus pallidus is your medial one, as we know over here. So now we know that the putamen, now we need to know the darker, and globus pallidus is lighter. Putamen is mainly afferent and globus pallidus is mainly efferent. These are the two differences. Let's have a look in this image. So as you can see, this is dark and this is light. So globus pallidus is lighter. So you can just remember it by the fact, we know that the putamen belongs to paleocortex, तो वो पीला हो चुका है, पुराना हो चुका है, so it is dark. ठीक है, and this is neocortex, so अभी नया है, अभी light color का है. That's how you can remember it for a while. I hope this is clear. Now let us have a look at the connections of corpus striatum. Very important for MD students also. This is very important. Connections of corpus striatum. The connections can be divided into the afferent and efferent, as we all know. Now let us have a look at the afferent connections. This is substantia nigra, and this is basically your cortex. So from cortex, the input is laid into putamen via internal capsule and external capsule. So these are known as your corticostriate fibers. Then from thalamus, it is again relayed into the corpus striatum, into the caudate, as well as into the putamen. So these are known as your thalamostriate fibers. From substantia nigra also, the signal is relayed into the putamen. These are known as your nigrostriate fibers. Remember that nigrostriate fibers are inhibitory to basal ganglia. बेसल गैंग्लिया का जो एक्शन है उसको रोकने का काम करना है substantia nigra ने. Now what we need to remember over here, from the cortex they are coming via internal capsule, external capsule. Good. Thalamus में कहाँ से आ रहे हैं? From thalamus they are coming from 3 nucleus of thalamus. The mnemonic is MD11. MD11 फालतू का निमोनिक है आई नो, बट थोड़ा सा राइम कर दिया मैंने इसको अपने हिसाब से, तो वैसे ही है बस ये. ठीक है जी. अब इसका नाम है MD इज medial dorsal, IL is intralaminar, and M is midline nucleus. So from here the thalamus and the fibers from the thalamus are coming. I hope that is clear about the afferent connections. Now let us move on to the efferent connections. Let me mark this territory so that I have to put my video over here. नहीं तो गड़बड़ हो जाती है. Okay. Now for the efferent connections, again I'll draw something similar. For the efferent connections, first of all, the signals from putamen will be transferred to the globus pallidus. उसके बाद ही जो भी कहानी होगी. So this is the reticular formation. This is the red nucleus. This is subthalamus, thalamus, lentiform, cortex, and this is substantia nigra. So let us have a look at the efferent connections. Now we know that the efferents will commence from globus pallidus. So firstly, from putamen, the signals will be related to globus pallidus. From globus pallidus, signals will be related to thalamus via fasciculus lenticularis and ansa lenticularis to ventro-anterior and ventrolateral nucleus of thalamus. I'll write them down, don't worry. From here, it will relate to cortex. Where in cortex? Premotor area. Then from putamen, yes, putamen will also give efferent to substantia nigra. So that is your cytonigral pathway. But from globus pallidus, it will go to subthalamus via the subthalamic fasciculus to red nucleus as well as to reticular formation. So these are the various efferents. Now let me so it is ventro anterior nucleus, ventro lateral nucleus. This is fasciculus lenticularis. AL stands for ansa lenticularis. So that is about the efferent. Now let us move on to the next nucleus in our case. So next nucleus we will study is claustrum. Claustrum is nothing but saucer shaped mass of grey matter present between external and extreme capsule. Structurally, it is related to basal ganglia. Functionally, it is related to limbic system. That's all for claustrum. Then amygdala or the amygdaloid body. It's a small almond shaped present in temporal lobe covered by insula. That's it. Now very important, substantia nigra. Substantia nigra consists of two parts, the dorsal part and the ventral part. The dorsal part is known as pars compacta. Ventral part is known as pars reticularis. Now over here there is a secretion of dopamine. Pars compacta is afferent and pars reticularis. It is also known by the name of some other names. Pars densa or some other names, I don't remember exactly. You can skip that one. And this is efferent. That is about the substantia nigra. You can remember it like DCD. DC मोटर पढ़ते हैं ना फिजिक्स में. So it is DC and D में D है, डोपामीन है, ठीक है, and it is afferent. Okay, then subthalamus. Subthalamus is a small grey matter. This is thalamus. This is subthalamus. Present under lateral half of thalamus, and it is separated from thalamus by something known as zona incerta. Now let us have a look at the clinicals. We will talk about Parkinson, chorea, athetosis, melismus. We will talk about these. The first, Parkinson's. Parkinson's is basically a condition that is caused due to deficiency of dopamine. So that will lead to lack of inhibitory effect of substantia nigra on the basal ganglia. Basal ganglia का function होता है आपका coordinated movements करवाना, आपका fine tuned coordinated movements करवाना आपका, जो हम लिख रहे हैं इसमें basal ganglia का बहुत बड़ा रोल है. So इन movements में problem आएगा due to deficiency of dopamine. So what will happen is resting tremors, bradykinesia, that is slow movements, बैठे बैठे हाथ ऐसे ऐसे होते रहेंगे, resting tremors. Third is pin rolling movement. पिन रोलिंग मूवमेंट का मतलब है बंदा ना ऐसे ऐसे करता रहेगा, ऐसे ऐसे मूवमेंट्स होंगे, जैसे हाथ में कुछ रोल कर रहा हो, पिन रोलिंग मूवमेंट, कुछ और नहीं रोल करना, ठीक है, पिन ही रोल करनी है. देन फेस विल बी ऐसे, अचानक से क्या हो गया, ठीक है, दैट इज नोन एज कॉग व्हील रिजिडिटी और मास्क लाइक फेस. नेक्स्ट कोरिया. नाउ कोरिया, हंटिंग, एथेटोसिस, बैलेंसिस, इन सब में कुछ ज़्यादा फर्क नहीं है, 19-20 का ही फर्क है इन सब के अंदर, तो बड़े ध्यान से सुनना. कोरिया इज बेसिकली इन्वॉल्विंग योर हेड, टंग एंड अपर लिम्ब. Mainly it is affecting these parts. So what is it? It is jerky movements of face, tongue, upper limb. It is of two types. हंटिंगटन कोरिया तो सबने सुना होगा. दूसरा है शिंडेनहैंस, स्पेलिंग है SHDENHAN, शिंडेनहैंस, Huntington. So Schindenhan's is seen in children, Huntington is seen in adult. It is due to rheumatic fever, ठीक है जी, and it is an autosomal dominant condition. Prognosis good, इसका मैं यहाँ लिख रहा हूँ, bad. लीजन कहाँ पर है, जैसे कि पार्किंसंस में लीजन क्या था, डोपामिन की डेफिशिएंसी सब्सटेंशिया नाइग्राम था. इस केस में, दोनों के दोनों केसेस में लीजन इज एट बेसिकली योर caudate plus putamen. That is about chorea. Now next, athetosis. Athetosis is slow राइटिंग मूवमेंट्स. अब राइटिंग मूवमेंट्स है तो खुद ही सोच लो किस पार्ट को इफेक्ट करेगा, डिस्टल अपर लिम्ब एंड डिस्टल लोअर लिम्ब. सो इट विल अफेक्ट डिस्टल पार्ट्स ऑफ अपर लिम्ब, लोअर लिम्ब. लीजन कहाँ पर है, लीजन इन दिस केस इज बेसिकली in neocortex, ठीक है जी. neocortex मतलब हो गया caudate and globus pallidus. यहाँ पर था caudate and putamen, यहाँ पर caudate globus pallidus में लीजन हो सकता है. नेक्स्ट belismus. Belismus is exactly opposite of athetosis. So belismus will basically affect your trunk, proximal limbs. Now in this case also there is involuntary movement. Involuntary movement of trunk and proximal limbs, can be upper, can be lower, दोनों में से कोई एक, upper limb और lower limb. If both upper limb plus lower limb are affected, then that is known as hemibelismus. Why hemibelismus? Because belismus में contralateral side effect होती है. अगर लीजन इस साइड पे है तो ये वाली साइड इफेक्ट होगी। तो अब क्या होगा, नॉर्मली ब्लेजर्स में या तो लीजन अगर राइट साइड पे है तो लेफ्ट हैंड जाएगा या लेफ्ट लेग जाएगी। हेमी ब्लेजर्स में क्या होगा, पूरा का पूरा लेफ्ट हाफ चला जाएगा। सो दैट इज हेमी ब्लेजर्स, आधी ही बॉडी चलेगी। सो दिस हैपेंस ड्यू टू vascular lesion involving subthalamic nucleus. So that's all for the basal ganglia. I hope ये आधे घंटे की वीडियो आपको समझ आया होगा. If you have any doubts or anything, you can write up to me on Instagram, Anatomy by Dr. Prabjot, or on S Prabjot. But follow करना मैंडेटरी है, आंसर चाहिए डाउट्स का तो. बाय बाय, हैप्पी लर्निंग.